Hispanics account for nearly 10% of North Carolina's population, but 23% of COVID-19 cases. Dr. Alexa Mieses-Malchuk is a family physician and assistant professor at UNC. She says our Latino population consists of a large number of recent immigrants who may not have the ability to work from home and face other challenges during this pandemic.
Not knowing how to navigate the system. Perhaps you speak a language different than English. Maybe you don't speak English at all. That can make it challenging to access healthcare.
Dr. Mieses-Malchuk says not having health insurance can be a barrier for some minorities.
What COVID is doing is putting a magnifying glass on health disparities. I'm hoping that we can come together as a society and really devise novel ways to make our healthcare system and our healthcare outcomes more equitable for our citizens.
In Chicago, 70% of people who've died from coronavirus are African Americans, who make up just 30% of the city's population.
That caught my attention right away.
Local community activist Pastor Thomas Dixon has been posting his concerns about the spread of COVID in the African American community.
There were early rumors put out that Black people were not susceptible, that this would not harm them. And so we have an entire community of people that are overlooking or ignoring the warnings and not following the guidelines because it's just business as usual.
In South Carolina, 36% of COVID cases are in African Americans, who make up 27% of the population.
Much of the time, we don't have access to quality health care, affordable health care. Many are walking around with undiagnosed conditions, pre-existing conditions that this virus is just looking for a host.